hip pain and pelvic pain. First thing you want to do with any type of pain is let your midwife or doctor or pregnancy healthcare for professional let them know about the pain so they can rule out it being anything serious and not, you know, general pregnancy pain. So if it's not serious pelvic pain, you're pregnant, and that's probably what your doctor is going to say, oh no, it's just part of pregnancy, you're fine. Well, I have some tips for you. So hip pain and pelvic pain oftentimes go hand in hand. If you're doing anything throughout your day, whether it's like an exercise like yoga or just part of your job or how you sit or stand, make sure that you're not distributing your weight unevenly. Like if you were doing yoga, lunges or warrior pose, or if just standing throughout your day, if you kind of stand on one hip, all that puts discomfort on your hips and your pelvis and can cause a lot of pain and discomfort. Also, when you're sleeping, if you sleep on your side, put a pillow in between your knees, because the collapse can cause pain, and then you can wake up in pain or just later on throughout your day, or you can have trouble sleeping at night. So make sure the weight is always distributed evenly. Just try to be conscious throughout your day, like, oh wow, I do always stand, put weight on one hip. Or some people even like sit, or if you sit cross-legged, stop doing all that. You want all your weight to be distributed evenly. Stop doing lunges, stop doing warrior poses. Squats are fine. Anything where both feet are on the ground evenly. Always, you know, fit, not all your body weight to one side or the other. Next, look up hip openers. Hip openers will not just help with hip pain, but pelvic pain too, which I found out on accident. I had horrible pelvic pain during my last pregnancy, and I did a lot of research and could find very little on how to relieve pelvic pain, and the things that we're finding were not helping me. And I was just doing hip openers because I had read that they're a good way to prepare for childbirth, for vaginal childbirth, and turns out it relieved my pelvic pain. Who'da thunk it? So look up hip openers. They are amazing for pelvic pain. I was having a lot of trouble with pelvic pain. Walking was a primary exercise for me. It's great for pregnancy and prepping you for childbirth. And I couldn't walk long distances because my pelvis would be in so much pain. And it was like I would have, like, that sensation of having to pee was worse. There was like something, like nothing was sitting right. And so walking was extremely uncomfortable. And it was like I was pregnant in the summer. My baby was born in September, and I live in Texas. So like at 9 months, like August, like that's the hottest time of the year. So I'm trying to walk around my neighborhood, and it's, you know, 90 degrees outside, and it's like, well, I'm scared to drink water because I already feel like I have to pee, and I don't have to pee, and I'm just terribly uncomfortable, and my pelvis hurts. So I got one of those belts. You can get them pretty inexpensive. Even like a $10 one that you get from Walmart is gonna at least do something for you. And then if you can afford a nicer one, get a nicer one or get one used. But anything that you can like adjust so you can make it tighter is probably better. They have ones made specifically for pregnancy that go kind of around your hips, and they're soft, so it's not like something it's not like a corset where it's gonna like hurt your stomach or go around your stomach. Most of them are like soft and Velcro, but you can like tighten them. But again, like even the cheap ones, anything that's going to give you a little bit of support around your hips is going to relieve some of that pain and pressure, and it could lift your uterus up a little bit, or your belly, or your baby, or whatever it is. It's like pushing into your bladder, and so when you're walking or sleeping, it could relieve some of that pain or that sensation of having to pee when you don't have to pee. So double good. And that's really it for pelvic pain and hip pain, because they do go hand in hand. Like some of us, I didn't even know that. So hip openers, watch how you sleep and how you stand and how you exercise, and make sure that you're distributing your weight evenly. And then look into getting one of those bands, because they help, and they help with back pain too, which I mentioned in the back pain video. It just all around support for the hips, and also if like the pain of having to pee when you don't have to pee. Great, easy peasy. Okay. Knowledge bitches.